So as we go through tonight, I want to make this very informal. So if you have any questions or any concerns or comments, please fire away. I like to kind of keep it around an hour, so you know, we're not obviously using too much of your time. But so let me just digress a little bit. So tonight is Nutrition 103. And we do a Nutrition 103 class, but actually this is kind of Nutrition 103 Part 2. And this is going to be very specific to the issues that we talked about. So we're going to get into cardiac issues, cholesterol issues, women's hormonal issues, which is a big one, and also gastric issues. And that affects a lot of different people. So we're going to talk about it from a nutritional standpoint in certain cases, but also a supplement standpoint as well. So we're really going to get into supplements. So Diana has provided you with some information tonight. First of all, there's a package. So we actually have partnered with a new supplier called Adiva. So adiva.com. And so I can take a step back here and say, I'm actually, for the last year, I've been taking a course in functional nutritional medicine, which is actually a mind-blowing course. It's all building on a lot of the stuff I've learned over the years in nutrition. And it's talking about affecting certain conditions and certain diseases with specific nutritional approaches, as well as supplementing with certain things. Now, it's kind of interesting because it really looks at a lot of, it's very evidence-based. So it looks at a lot of studies. Please come in, yeah. So it looks at a lot of studies around the world. So the interesting thing is that there's a lot of different countries, other than Canada, that do things that are very different than what we do here. Okay. The incidence of many diseases are a lot less in other countries. The remission rate of many diseases are a lot greater in other countries. And the mortality rate is much better in other countries with certain things that they do based on their diet, based on the way they care for and treat certain diseases. And it's interesting because in North America, the medication rate is significantly higher than any other countries in the world, right? Canada and the United States have the highest, cumulatively, the highest usage of medication anywhere in the world. In fact, the statistics say 6% of the population exists in Canada and the United States, but we use 60 to 70% of the world's medication. It's astounding. So it's largely these diseases, we talked about this at dinner, for those of you who were at dinner last week, largely a lot of those diseases are lifestyle induced. So we're going to get into this tonight, and we're going to talk about different ways to approach these different conditions, because I think these are hot topics. You know, cardiac disease, cholesterol issues, you know, skin and gastric problems, because they're very related, and also mental health. That's all related too. So we're going to talk about how gastric affects all those different things, as well as the last one, which is women's health issues, women's hormonal issues. Okay, all right. So let's get into this here. So the first one we're going to talk about tonight is cardiac. So we're going to talk about cardiac and cholesterol. And really this encompasses anybody who's been affected by high blood pressure or angina, things like that. High triglycerides, high cholesterol, if you've ever been diagnosed with high cholesterol, arrhythmias, or even diabetes can be really related to cardiac issues. Okay? In fact, a lot of people with diabetes end up passing away or dying of a heart attack. Okay, so that's really, really related. So we're going to talk about how these different things are affected. So we're going to get into, right off the bat, the supplement use, which can be really helpful for a lot of people with these conditions. So one thing I talk about all the time is CoQ10, right? We talk about this very regularly. So we actually talk about this in the other Nutrition 103 course because it is so important. So if you don't know what CoQ10 is, it's actually involved in normal body reactions. It's involved in producing energy in your body. So CoQ10 is naturally found endogenously in the body. Okay, CoQ10 helps oxygen produce energy. Now, a lot of medications will deplete CoQ10 in the body. Okay, for instance, cholesterol medications is notorious for depleting CoQ10. In fact, if anybody's ever taken cholesterol medication, does anybody here take cholesterol medication? Yeah, you do, sir? Okay, and if you know people that take cholesterol medication, one of the main concerns or main side effects of cholesterol medication is muscle cramps and muscle aches. They get achy back, achy legs, sore muscles, sore joints. And that's because of the depletion of CoQ10, and those muscles are starving for oxygen. Okay, so you really need CoQ10. So if you're taking cholesterol medication, you absolutely should be supplementing with CoQ10. Okay, number one. Now, Here's the interesting thing. So CoQ10, like I said, is found in the body. The chemical forms are called ubiquinone and ubiquinol, right? So if you hear those things, they're actually referring to CoQ10. It's decreased by statin and beta blockers. So statin drugs are the cholesterol drugs. Beta blockers are typically used for high blood pressure. They slow the heart rate down, okay? It aids in mitochondrial respiration. So mitochondria are those things, they're basically the lungs inside the cell. They process the oxygen inside the cell. So it's really important for those mitochondria to work at their optimal function for energy levels, okay? As your decrease in CoQ10 is a cause of muscle pain, as we talked about, cramping. And it's interesting because heart attacks, what's your heart? It's a muscle, isn't it, right? Your heart is a muscle. Your heart requires oxygen. So if you're taking a medication like cholesterol meds, like Lipitor, Crestor, they're probably the two most common ones. If you're taking those medications, it decreases CoQ10 even in the heart muscle, which predisposes you to a higher risk of heart attacks. So it just kind of it's a sort of counterintuitive, isn't it? You're taking this cholesterol medication to lower your risk of heart disease, but you're actually putting yourself at higher risk for a heart attack because you're decreasing this CoQ10. So it's very important to supplement with that. And it can also be very helpful for athletes for athletic recovery. Okay? All right, so here we go. So the next supplement for cardiac issues is hawthorn. And this is used very widely with many naturopaths will prescribe this for anybody who's taking any type of cardiac or blood pressure medication because it has a natural blood pressure lowering effect. Okay, so how does hawthorn work? Well, there's active ingredients in hawthorn. Hawthorn's a natural supplement known as procyanidins. Okay, that's the active ingredient. And they also have been shown to further enhance levels of ATP energy. So they actually allow the muscle, the heart muscle, to become more energetic, stronger. Okay? So hawthorn also improves the blood flow through the coronary arteries because it has a relaxation effect on those coronary arteries and it allows more blood to enter those coronary arteries around the heart. So it nourishes the heart with more blood and blood carries the oxygen, right? Okay. So that's really important. So it helps keep the blood pressure down. Coenzyme Q10, as we just talked about, and hawthorn work very synergistically. Okay, they work very, very well together. It's been shown in studies that they both have a beneficial effect on lowering blood pressure and reducing the incidence of heart attacks and heart disease, but together that effect is amplified. Okay? So, and again, clinical studies in different countries, as we were talking about, Japan, Germany, and other European and Asian countries demonstrate that from a therapeutic standpoint, supplementing with hawthorn and or coenzyme Q10 can be effective in the reversal of certain cases of congestive heart failure, in lowering blood pressure, or improving cases of angina and arrhythmias. So, and the last one here for cardiac issues as far as blood pressure is quercetin. Okay, now quercetin is really, and some of these are largely, maybe some of you have never heard of this type of stuff. Quercetin is a natural anti-inflammatory. It works really well for people with arthritis. Okay, so it's in combination with a lot of supplements like glucosamine sulfate. You've heard of glucosamine sulfate for joints, rebuilding cartilage in joints. Quercetin is often put in those concoctions because it actually helps decrease a lot of inflammation. But how does it work in the heart? Well, it's a flavonoid that acts as an anti-inflammatory and an antioxidant. Higher intake and blood levels of quercetin are associated with lower risk of cardiovascular mortality in a number of human studies. Okay? So other studies suggest that quercetin helps to reduce the risk of heart attack and related problems by decreasing inflammation in the blood vessel walls. As such, it's an important ingredient to take with coenzyme Q10 and hawthorn in regards to preventing heart and vascular disease. So what I was saying, so we've partnered with this company Adiva, and we're starting to get a lot of their supplements in. This is stuff that my wife and I are now taking. I've got some of my family members taking it who've had blood pressure problems in the past, so we have this here now. And so this is Cardio Essentials, and the neat thing about Cardio Essentials is it takes into account all of the things that we just talked about. Okay, so Cardio Essentials actually has CoQ10, it has hawthorn, and it has quercetin inside in the doses that are relevant in the studies that have been provided. So in your packages that you received tonight, you'll see Cardio Essentials, and it actually shows you some of the relevant data and talks about some of the studies and how it is affected and how it's taken. Okay, so that is a really worthwhile supplement. So if you're having blood pressure issues, if you're on beta blockers or calcium channel blockers, diuretics, this is a really good one to take, okay? For those people who are taking blood pressure medication, hopefully you're taking your blood pressure regularly. That's really important, you know? So if you haven't bought a blood pressure cuff at Shoppers Drug Mart for 60 bucks, go buy one. It's worthwhile. Then you can take your blood pressure 2, 3, 4 times a week or daily and keep a log of it. So what you're going to find when you start taking this, you'll probably see it start to come down, okay? So it might even come down below a normal range, which means that you got to talk to your doctor and say, okay, that medication probably has to come down or maybe be eliminated altogether, which is really, really common. Yeah. So obviously, we always talk about lifestyle change. So this, and I'm going to say, obviously, I always say nutrition first, exercise, very important, and then supplementation on top of that. So just to say that I'm not, you know, a lot of people have the mentality, I forget about the nutrition, I'd rather just eat my chicken wings and french fries and poutine so I can take my medication, you know, and that keeps my blood pressure down, and I'm too lazy to exercise, so I'll just take this and maybe I can add a supplement. So but I want to address that because that's, again, very important because it all functions together, right? But the supplements absolutely will work with the medications, and it may allow you to decrease some of your medications too. And I've seen that actually very, very commonly, okay? Okay, so we're going to talk about gum google. So we're staying on the cardiac topic here. Now we're going to get into cholesterol. Okay, so for those of you taking cholesterol medication, these work hand in hand. So they work concomitantly together. So gum google, this is interesting. Not a lot of people know about this, and I really didn't know a lot about it before I started studying it. Gum google is naturally found in India from the mukul myrrh tree. It comes right from a tree in India. And it's actually used in India. So gum google is an actual prescription medication in India for cholesterol. So they don't necessarily give Lipitor or Crestor to patients in India. They give gum google. So gum google can be bought as a supplement. So it's derived from this mukul myrrh tree, which contains gugulsterones, the active constituent that account for its cholesterol and triglyceride lowering effect. Okay, so it has a natural effect on your body to lower cholesterol and triglycerides in your bloodstream. Okay, and so why is that important? Well, lowering cholesterol and triglycerides will allow your blood not to plaque up as much, right? Not to be as sticky, so it won't form that atherosclerotic plaque in your arteries, which is the dangerous thing with too much cholesterol, especially the bad cholesterol in your body. Gugulipid was granted approval in India for marketing as a cholesterol and triglyceride lowering drug in 1986 due to its impressive efficacy and safety. Gugulipid has been shown to help the body clear excess cholesterol and triglycerides from the bloodstream. So really helpful, very easy to use type of supplement for cholesterol. Okay. The other one is artichokes. Artichoke is obviously a natural vegetable. If you take the extract from artichoke, the artichoke leaf, again, that has been shown to block the body's replication of cholesterol. So what it does, artichoke leaf extract contains active constituents that help flush cholesterol from the body via the fecal route. So what it does is it prevents reabsorption. Okay, so you have cholesterol in your diet, right? Or, for instance, bile acids that get secreted into the colon, which are full of cholesterol. It'll stop them from being reabsorbed back into the body, and of course you'll dismiss them when you go number 2. Okay? So it increases the flow of cholesterol and bile, which is a building block of cholesterol, to from the liver to the intestinal tract. Human studies indicate that artichoke leaf extract alone can reduce LDL cholesterol, which is the bad cholesterol, right? The good cholesterol is HDL. That's a good thing to have in your body. LDL cholesterol is the bad cholesterol by 23%. That's unbelievable. So 23%, that's really significant. Just taking those supplements can allow people to literally get off their cholesterol medication. Okay? So, and again, I would say same thing to answer that question before. Diet, you have to address your diet. If you have cholesterol issues, absolutely that's a dietary thing, right? In 99% of cases, it's a dietary lifestyle thing, so you have to address that. Exercise is going to help lower your cholesterol naturally, but this is a great natural way to help you lower that cholesterol, okay? So the Diva produces a product called Colafort, which has gum google and artichoke leaf extract in it. So if you're taking cholesterol medication, this then becomes a great supplement to use, and many people actually have, and I'm not saying I'm telling you to do this or not, but stopped their cholesterol medication, started taking this, and had as beneficial or even better effects. Okay? Okay. All right, so gastric issues. So there's lots of different types of gastric issues, okay? So it can be anything from indigestion, bloating, cramps, irritable bowel syndrome, IBS, leaky gut problems, reflux or GERD, gastrointestinal reflux disease, Crohn's or colitis, ulcers, gallbladder problems, or even hiatal hernias, okay? So we're going to talk about, and of course there's a lot of other gastric problems too, celiac disease. It's actually been shown that people that have chronic problems with gastric issues, right? And I mentioned this earlier, gastric problems can be so related to emotional disorders, mental health problems, related to skin problems, okay? So clearing up gastric issues can really help your body start to function better, and people that have been diagnosed with all these different problems have a much higher incidence of colon cancer, much, much higher, okay? So it's really important to address these issues, and so many of them are very much driven by nutrition, okay? All right, so here we go, let's get into this, okay? So here's some basic things that apply across the board when it comes to gastric issues. So eat a diet low in saturated fats. Where do most saturated fats come from?
Meat.
Meat, exactly, meat, right? Most vegetarians don't have gastric issues, right? I've never seen a vegetarian with irritable bowel issues, right? It's very uncommon, really, really uncommon that people have plant-based diets have a lot of gastric issues, Crohn's, colitis, things like that. So eat a diet low in saturated fats, trans fats, deep fried and breaded or battered foods, and replace those bad fats with good fats. So omega-3 fats, monounsaturated fats like olive oil, even medium chain triglycerides, because those are good and helpful for the body, okay? Eat a diet high in fiber. So emphasizing flaxseed, I can't emphasize that enough. Flaxseed has so much health benefits for you, right? They're a bulking agent for your stools. They have great ingredients in them which are very beneficial, cancer fighting. You know, there's so many good qualities to flaxseed. Fruits and legumes, peas and beans, right? Great sources of fiber, peas and beans. Vitamin D levels, okay? So you can actually have your vitamin D levels measured and monitored with a blood test, but your vitamin D levels should be typically above 75 nanomoles per liter. And it's actually been shown people that have a vitamin D level of above that have much lesser rates of many different cancers. When people get below that number, or down in the 30s or 40s with vitamin D levels, cancer rates are really prevalent, really prevalent. So keeping vitamin D up there. So even aside from going and getting measured, typically to maintain a vitamin D level of above 75 nanomoles per liter, if you're taking 1,000 to 2,000 IUs per day. Now Health Canada recommends you take 400, okay? Most cheaper multivitamins contain 400 IUs. You get a higher potency multivitamin, and that contains 1,000 IUs, and I like to even supplement beyond that with at least another 1,000. If my immune system's working overtime, if I have a cold or flu, I'll bump that up by another 2,000 to 3,000 even, up to 5,000. Especially even in the winter months. I might even take a little more, because what's lacking in the winter? Sunshine, right? And we need sunshine to process vitamin D, okay? So vitamin D, very, very important. And for gastric issues, very important, okay? Take a vitamin B complex with these are the two constituents, especially in a B complex, that are really, really important. All B complexes or all B vitamins are important, but these two, when it relates to gastric issues, are extremely important. Vitamin B12 and folic acid. Well, why is that? Well, this is interesting. So B12, naturally, as you get older, you don't have to do anything different. You can eat a great diet as you get older, but what happens is that as you get older, your body's ability to produce stomach acid starts to decrease, okay? And you lose something called intrinsic factor, right, in that stomach enzyme production, okay? When your intrinsic factor goes down, your ability to absorb vitamin B12 becomes a lot less. Vitamin B12 is really important in a lot of chemical reactions in the body. It becomes a cofactor. It's important in your brain's ability to function, okay? So as people, this is why a lot of people, as they get older, can't absorb B12, they don't take enough B12, and they start getting memory problems, dementia problems, Alzheimer's. It's related to that, okay? So really important to start to supplement as you get older with a multi-B complex, a big B complex. Let me just finish this thought here, because it's in my mind. So, and then the other thing here is folic acid. Now, folic acid, again, is really important. when should women take folic acid?
When they're pregnant.
When they're pregnant, exactly. Now, why is that? Anybody know?
Well, the baby takes it away from the body.
The baby needs it, and what happens is folic acid is really important in what's called DNA replication. Okay, so when cells replicate, they're replicating their DNA. They really needs folic acid. So mothers that are pregnant, when the baby's developing, if they don't have enough folic acid, a lot of times what happens is the baby becomes malformed. You get abnormal cell formation, which can lead to childhood diseases, deformities, things like that. So folic acid is really important for nervous system function and DNA replication. Now, why is DNA replication important when you get older? Because as cells divide, what happens? They either divide healthy or they divide unhealthy. So if they don't have enough folic acid to reproduce that DNA properly, they produce abnormal DNA, which is the start of what's called a mutation, right? And mutations tend to form cancer cells. It's fascinating stuff. So that's why folic acid is so important. So those two specifically, now folic acid is really important in the epithelial cells within the gut, okay? So replication of those epithelial cells, if the gut lining is replicating itself healthy, the chances of you getting colon cancer become a lot less. So B12 and folic acid, there's the reasoning behind it, okay? Another one is selenium. Selenium has really been shown to be a very important nutrient with regard to fighting against gastric problems and again, colon cancer, okay? So keeping our selenium levels up or supplementing with that, or just taking a multivitamin that has selenium in it, that's adequate. Calcium intake, so getting proper calcium. And remember, we talked about this earlier. Calcium doesn't necessarily come from dairy. Dairy is not a good source of calcium. Most dairy has to be fortified with calcium and vitamin D because it's robbed from it with the processing part of it, the pasteurization and everything, okay? So a lot of calcium comes from green leafy vegetables. You know, there's a lot of calcium. Bok choy, yeah. I mean, cruciferous vegetables, right? Has a lot of broccoli, things like that. Have a good calcium sources. So, but also supplementing on top of that is important again. So if you're taking a good high potency multivitamin, you're going to get extra sources of calcium. Okay. Vitamin C. Consider vitamin C a couple times daily, and vitamin E, because those are good antioxidants. They help with gut health. Okay. Be very careful with alcohol consumption. If you have gastric issues, alcohol is a killer. It's an absolute killer, right? So typically 3 drinks per week is kind of the deadline as it's been shown. So if you're drinking more than 3 drinks per week, which is easy to do, isn't it? You know, like a glass of wine 2 or 3 days a week, and all of a sudden there's your limit. Anything more than that, you're really putting a lot of stress on your digestive system, okay? Cruciferous vegetables, as we talked about, at least 3 times per week, so put those into your diet. If you don't eat a lot of vegetables or you don't like vegetables, get some powdered greens. I mean, we sell veggie greens here, and I use a scoop every single day, because I know, like, we eat vegetables quite regularly, but I like to have extra, so I always put a scoop in every single day. Avoid processed meats, right? So anything that's been manufactured, so that means lunch meats, right? Salami, bologna, anything that's processed like that, terrible for your system because it's full of nitrates and nitrites. As well, the other thing is when you cook foods at high temperatures, you start charring and smoking the meat, and that becomes very damaging for your digestive system as well. Okay? All right? Last couple things here. Smoking, I mean, that's a no-brainer, right? Smoking, not only because it causes lung cancer, it affects the body in all different ways too. So that can be another cause of gastric issues. Remain at your ideal weight, right? So anybody who's overweight, obesity, high risks of different types of cancers and gastric diseases, okay? And have a regular exercise program. It actually has been shown that increasing your level of activity lowers your risk of colorectal cancer and polyps. Regular moderate activity. So in other words, doing something that makes you breathe at the same rate as you would during a brisk walk. So you don't have to go out and become a marathon runner, you know? Go out for a brisk walk, do an activity that just raises your heart rate enough that you're just breathing, you know, even so you can still carry on a conversation, but you know your lungs are working to get the air in. That is great for your body, great for your gastric issues. So I would really encourage you to do that. It lowers the risk, and even vigorous activity has a greater benefit yet, okay? All right, so here's some neat gut facts here. And, you know, it's interesting because I consult. I mean, I've been in practice now for 26 years. And I talk to people about a lot of different health conditions. I mean, it's, you know, you assume most people come to chiropractors because they have back pain or neck pain or headaches, you know. But you'd be surprised at some of the people that come in and want to sit down and talk about natural ways to prevent cancer, or that they've been diagnosed with cancer, what do I need to do, or heart disease, or all kinds of different conditions, autoimmune disorders. We've seen the gamut of it. Aside from getting their nervous system functioning well, which is what we're really good at, I mean, that's my focus, my specialty here. We adjust the spine, we get the nerves functioning great, and that really does help people heal. So I encourage you, so those of you who haven't had your spine checked, get your spine checked. I mean, that is so vital. But the second most important thing, in my opinion, is nutrition, okay? And so it's really kind of ties in so well with the gut and what you're putting in. And we alluded to this already, but so if you think about this, you have actually more nerves in your gut than you do in your entire spinal cord. There's so many receptors in the gut that recognize different nutrients and different toxins and antigens, and it really does affect how your body functions. There's a direct connection between your gut and your brain. So your gut has 100 trillion bacteria. 100 trillion bacteria, that's 3 pounds of bacteria, and all those cells are more than human cells that can be found in the rest of your entire body. Okay? So the gut really is full of all kinds of different things that are really dictating how your body is communicating and functioning. Having good gut bacteria dictates how well your immune system will function. So if you want glowing and clear skin, right, your skin is so related. Good bacteria plays a vital role in the appearance of your skin. Surprising 95% of the serotonin. What's serotonin important for?
Happiness.
Happiness, exactly. It's the happy chemical, right? So serotonin is actually produced in your body. A lot of the serotonin in your body is produced in your gut. Some is produced in your brain, but that's involved in mood. It's a mood chemical, right? It's involved in other things, but it's a mood chemical. So if you look at anybody who's taking antidepressants, right? Antidepressants typically are a chemical way to raise the serotonin, right? Most of them are called SSRIs, which are selective serotonin reuptake inhibitors, which means that they stop the breakdown of serotonin. So they elevate the serotonin. So you have that happy chemical in your brain, which makes you feel more at ease, right? Less depressed. But it's a chemically way of inducing that, right? There's a lot of addictions to those and cause all kinds of problems. So I really recommend against going on antidepressants. And if you are on antidepressants, there are ways to come off them, but you have to be really careful. You never go cold turkey off those. Never, ever, ever, okay? Because that'll cause rebound depression. But the first thing that needs to change is your nutritional approach, okay? Get your body producing more serotonin. So the happy molecule in your brain is made in your gut. Balance your gut with good bacteria, and you can help improve your mood and improve your mental clarity. So for those people walking around in brain fog, or you're just not happy, for men, one of the signs in men is they're constantly angry all the time, just angry at everything. That's a sign that you're entering into that depressive state, your serotonin levels are low, and usually it's caused by bad nutrition, right? In most cases. So let's talk about some of the different supplements. So the first supplement I want to talk about is that your gut contains a lot of enzymes which break down certain foods, okay? And certain foods require these enzymes to break them down properly. So there are, there's amylases and proteases which break down protein. Amylase breaks down starch, lactase breaks down milk, lipase, cellulase, maltase, sucrase. So there's all these different things. So let's say, for example, say lactase. If you had a lack of lactase, you would be then what? Lactose intolerant. Exactly. You wouldn't be able to digest milk properly. Okay? So here's the neat thing, is that prebiotics actually they add more of these enzymes into your gut, so you have a better ability to break down those types of foods. Okay, number one. And the other thing with prebiotics, so there's a difference between prebiotics and probiotics. Okay, so prebiotics will also have this fructooligosaccharides, FOS, okay, and inulin. So these two things, this is an interesting thing, because what this do is that is food for the friendly gut bacteria. So the friendly gut bacteria need good nourishment. That provides them good nourishment so they can replicate. So it helps improve your friendly gut bacteria. It's giving them good nourishment, okay? So it improves digestion, improves immune function, decreases skin reactions, food sensitivities, and different reactions, okay? So why would you want Prebiotics, what would be a good indication for that? Well, if you're having digestive complaints, like gastritis or bloating, cramping, things like that, that's a sign. Irritable bowel problems, eczema, so if you have skin issues like eczema, dry skin, scaly patches and so on, breakouts with rashes, autoimmune or inflammatory bowel conditions, so Crohn's and colitis, really important. Reflux disease, very important. Candida, if you've got a candida issue, you've been diagnosed with leaky gut, and again, that we talked about the mental acuity. If you're experiencing brain fog, if you're finding that you're exhausted through the day, if you're having a hard time sleeping, again, these things can all be totally related to gut health. Yeast infections, so chronic yeast infections in males or females, allergies, bloating, cramping, or celiac disease. Great indications for prebiotics. Okay? Secretion of digestive enzymes decline as we age. Okay, so these up here naturally start to decline over time. You don't, like when you were young, in your teens, you could probably eat anything and get away with it, right? When you get into your 40s, 50s, 60s, you can't do that anymore. And that accounts for an increased incidence of digestive problems, more so in women. More so in women. Okay, so that's why, so this is a really cool product, Flora Essentials, and Adiva makes this Flora Essentials, and you'll see that in your package as well. But that includes prebiotics. So all those prebiotics that we talked about, all of these enzymes, it includes in that capsule, in that supplement. And it also includes the fructooligosaccharides and inulin. So it's a precursor to improve your friendly gut bacteria. Okay, great product. Next one is probiotics. Okay, so there was prebiotics, which we just talked about, now probiotics. Now, when you take a probiotic, that's actually physically putting more gut bacteria, more healthy gut bacteria into your body. So it's not trying to stimulate the gut bacteria that's already there, it's actually putting more good gut bacteria into your body. So probiotics contain live strains of good bacteria, right? Delivered to your gut in a convenient daily pill, which can help balance your intestinal. The microbiome is the environment that those bacteria live in, right? So what certain things would upset that microbiome or the homeostasis? What do you think? Lucy knows. What certain things would upset that microbiome in your gut?
Oh, okay. Yeah, well, first of all, alcohol, of course.
Alcohol, big one. Yeah, big sign. Yeah. Okay, what do you think?
Antibiotics.
Yes, big one. Yes, exactly. Yeah, you're going to say antibiotics. Yeah. So that's huge, and that's one. I was hoping somebody would say that because antibiotics are widely prescribed for lots of different things. So very important. If you ever take antibiotics or you know somebody's taking antibiotics, they absolutely should be putting probiotics back in, right? And they should put probiotics back in during the time of taking antibiotics, as well as afterwards as well. And I would say afterwards, then you want to start stimulating with prebiotics the growth of that healthy bacteria again, because the antibiotics will kill off all the bacteria, the bad stuff and the good stuff, right? A lot of antibiotics are the #1 medication for reactions. Okay? All right, so building your gut with more friendly bacteria can help prevent over-colonization of bad bacteria, which is a major factor in how well your immune system can respond to invading harmful pathogens and fight and prevent infections. Research has actually shown that optimal balance in your gut is 85% good bacteria to 15% bad bacteria. And although the perfect percentage may vary for each individual, the most important objective is to achieve health is to create an environment for healthy bacteria to flourish. Okay? So really important to help those good bacteria grow. And it affects everything. Like I said, it affects your mental state, it affects your skin, it affects how your body functions. So the other thing, and we were talking about, of course, obviously, alcohol, antibiotics. Stress is another one. So if you're chronically stressed, that upsets your normal bacterial biome, right? And the other thing is just a bad diet. If you're eating a diet that's high in fast foods or bad trans fats or a lot of sugar, awful. Awful. The bad bacteria and cancer cells love sugar. They love sugar. Okay. So this is something that we've been carrying this for a long time. Ultimate multi-probiotic. So keep that in the back of your mind. That probiotics are great to help give your body just a boost to grow or to add good bacteria to your gut. Okay, so any other gastric questions? All right, so let's go into women's health issues. Okay, women's hormonal and health issues, right? So even for the men here, this would be helpful for you because your significant others, your daughters, granddaughters, it'll be important for you to counsel them on this as well. Okay, so this is going to affect a lot of different things. So this affects every woman at every stage of life. From anything from PMS, menopause, ovarian cysts, dysmenorrhea, endometrial or cervical dysplasia, which can lead to cervical cancers or endometrial cancer, and osteoporosis, okay? All related to hormonal issues. So let's talk about this and how can we affect that naturally? You have a question, Bob?
Yes, those ovarian cysts, would that also be known as PCOS?
Yeah, polycystic ovarian syndrome. That's what PCOS is, yeah. So ovarian cyst, that's exactly the same thing. You're right, yeah, great question. Okay, so here's some supplements that have been directly shown to affect and help with hormonal issues. Now, here's an interesting thing too. And I was hoping she'd be here tonight, but she's not here. There's a lady in the office who was just recently diagnosed with breast cancer. And obviously I'm not going to divulge her name, but however, this can really be related to anybody who's concerned about being diagnosed with breast cancer or has been diagnosed, right? Especially with estrogen positive breast cancer, because that's totally hormonal related. So controlling those hormones and reducing the bad estrogen or the increase in bad estrogen in your body can really be beneficial to help people go into remission or prevent the diagnosis of breast cancer itself, okay? So black cohosh is, and that's what reminded me of that, this is a great supplement to help normalize estrogen, help normalize those types of issues. So it contains, black cohosh contains triterpene glycosides with the estrogen potency of estriol. So that's the weakest estrogen, right? Now what happens is when you take black cohosh, what it does is it displaces the body's production of estrone, which is a very strong estrogen. So here's the thing. So as we go through menopause, as the women go through menopause, your body's ability to produce progesterone starts to go down, right? Because your body has to produce progesterone to produce follicles, you know, and have your normal ovarian cycle and so on, like, you know, every month. And what happens is the body's ability to produce progesterone starts to go down, and so that estrogen can't convert and it turns into estrone. And high levels of estrone cause all kinds of problems. That's what can cause, you know, your body being robbed from calcium, so you start to get osteoporosis. It can cause your body to react very poorly to high levels of estrone in ways that will start to develop these mutations in cells and cause different forms of cancer. So black cohosh, what it does is, because it's got that weakest form of estrogen in it, the estriol, displaces the estrone, okay? So it limits the body's production of that bad estrogen, so it limits the effects of what that bad estrogen causes, okay? I hope I explained that properly. But what it does is it decreases the release of follicle-stimulating hormone and luteinizing hormone from the brain, and also the noradrenaline. So what it does is it reduces menopausal symptoms. So if you've had a lot of bad menopausal symptoms, hot flashes, you know, night sweats, all kinds of different things like that, it reduces those symptoms. It causes no overstimulation of the breast and reproductive tissues, hence the lowering incidence of breast cancer. It maintains vaginal tissue integrity. So a lot of women find that their libido goes way down because the ability to become lubricated, you know, vaginal lubrication becomes a lot less as you get older. Black cohosh helps that, okay? Supports skin integrity as well for anti-aging. So it does help prevent against wrinkles, and it does help normal aging as far as the skin goes, okay? So really, really nice supplement when it comes to hormonal changes. The next one that's very helpful, been shown to be very helpful, and is used widely across the world, is gamma-oryzanol. And gamma-oryzanol is a natural component of rice bran oil, okay? So it's a very natural component. What it does is it actually blocks the release of FSH and LH in the brain. So if you have an overstimulation in menopause of FSH and LH, what happens is those estrone levels start to rise in the body, and gamma-oryzanol blocks that, okay? So it reduces menopausal symptoms. It's actually used as a prescription drug in Japan. So that's actually prescribed with a prescription in Japanese culture, Japanese medicine. It reduces cholesterol as well, which is a real nice beneficial effect, because a lot of times that they go hand in hand. Because remember, what is sex hormones like estrogen and testosterone? What are they made from?
Cholesterol.
Exactly, they're made from cholesterol, right? So by lowering this, you actually lower the effects of cholesterol in the body. So or by blocking FSH and LH, you lower the effects of cholesterol in the body. Next one is soy isoflavones. Okay, so isoflavones are a product in soy. Now, soy's received a lot of controversy. You know, don't eat soy or don't eat soy, eat a lot of soy. It's been shown statistically that cultures that have regular soy in their diets, specifically in the Far East, in Asia, have much lesser incidences of hormonal-related cancers, breast, endometrial, any type of cervical cancers. So soy isoflavones have actually been shown, because they contain these substances called genistein and diazinon. They're the active components in the soy, in the extract. They have this weak estrogen effect as well. They decrease hot flashes. They stimulate certain receptors which slow cellular replication. Now, why is that important? Because cancer cells tend to replicate much faster than normal cells. So if they can slow replication, they actually slow down production of cancer in the body. Okay? They're shown to reduce the mitosis-apoptosis ratio in breast cancer patients. What does that mean? Well, mitosis is the cell division, so the production of more and more cells. Apoptosis is cell suicide, so cell death. Okay? So they actually reduce that ratio. So they slow down the division of cells, and they increase the death of those bad cells. Right? So it's actually lowering the number of cancer cells that are producing in breast tissue. Reduce bone loss, which is obviously a concern for women, especially with hormonal issues, osteoporosis. They decrease cholesterol, and they support skin integrity as well. So those three supplements together work really well, and again, Adiva, and they put them together in this one main package, and it's a women's hormonal balance. And I'll come back to this slide here, women's hormonal balance. So that, again, is a real good one for any women who are going through hot flashes. My wife just started taking that. And so, you know, it's really worthwhile type of supplement too. So I'll come back to this one. So are lots of sources in food. So if you want to get more soy in your diet, here's some examples, right? And these are good, healthy examples, especially for women, but also for men too, because these also will have an effect with prostate cancer. I was talking about that last week at the dinner. Soy is a good thing for men to put in as you get older because it reduces benign prostatic hyperplasia or hypertrophy, and it does prevent prostate cancer problems. Okay? So tofu, which is basically ground up soybeans, right? Half a cup. There's different percentages. Soy milk, unfortified soy milk, fortified soy milk. There's lots of soy isoflavones available in soy milk. Pardon me?
It had to be soy milk, had to be fortified.
Different brands, right? Different brands. So roasted soybeans. You have green cooked soybeans like edamame. I think I'm pronouncing that correctly. Edamame. Black cooked soybeans. So different types of soybeans. Great to have in your diet. Miso. Soy protein. So if you like for instance, I use a lot of whey protein, but you can also buy soy protein. That's a great source of soy as well. Textured soy protein or tempeh, right? Very common. And that's a great source of soy as well. So there's easy ways to get that in your diet as well. Okay. And of course, our women's hormonal balance. So who would be recommended to be looking at something like this? If you're having PMS issues, dysmenorrhea, so painful cycles, managing, that can be very helpful. Management of menopausal symptoms, hot flashes and so on. Fibrocystic breast disease. So if you have cysts in your breasts or perhaps precancerous lesions in your breast, that would be something to be considering. Uterine fibroids, endometriosis, and just promotion of well-being, anti-aging outcomes, and bone support, especially for women over 50. If you've had or been diagnosed with breast cancer, great supplement to be putting in on a regular basis. Okay? All right. So iron supplements. So what happens is that a lot of people are very low in iron, right? We get depleted in iron. Our absorption of iron gets lower as we age. Sometimes our nutrient factor of iron, because what does iron need to be absorbed into the body? Anybody know? Vitamin C. So vitamin C is necessary for iron to be absorbed through the gut. So you need vitamin. So a lot of us don't eat enough fruits and vegetables, to get adequate vitamin D, or you're not supplementing with vitamin D. So of course your iron's not able to be absorbed. So the other thing that becomes a cofactor with iron supplement and production of red blood cells, which need iron to produce red blood cells, because it's the heme in the red blood cell that carries the oxygen, right? So if you have lack of iron, or inability to produce red blood cells properly with enough heme, what happens? You get less oxygen in your body. How do you feel? Tired all the time. Chronically tired, fatigued all the time. And that's a sign of an iron deficiency. So that can be shown in a blood test. So if you've been shown to have low iron, there's different ways to promote iron improvement. So that could be classified as anemia. So iron deficiency is classified as anemia. And you'll see fatigue, weakness, dizziness, difficulty concentrating. Okay? Very common forms of iron deficiency. Pregnancy, menstruation, if you're on dialysis, or if you're exercising very chronically, like for instance myself, I'm really cautious of my iron and my supplement intake. I take supplements just because I do exercise every day pretty hard, and so I want to make sure that my supplement are always topped up. Kids with ADHD, right, attention deficit or hyperactivity disorder, most cases have iron deficiency, right? So supplementing with iron is very important. Or if you've been on long-term antibiotics or heart cholesterol meds, they will deplete iron as well. So you've been taking cholesterol medication for a long time, Lipitor or anything like that, your iron more than likely will be low. Okay? So Adiva makes nature's iron here. So there's lots of natural ways to improve your iron. I mean, you can take B50 complex, which has B12 in it, has folic acid. They will help boost your iron stores, you know, because vitamin C, that's another way to boost your iron stores, right? But it's nice if you can get it all in one package. So nature's iron is great because it contains everything your body needs to absorb iron at a higher rate. And it actually provides a great source of iron that's chelated to a protein which is easier to absorb. And that's the beautiful thing I love about this product, because what happens is these are chelated amino acid carriers for maximum absorption in the bloodstream. Heme factors include ascorbic acid, which is vitamin C, methylcobalamin, which is vitamin B12, folic acid, and pyridoxine, which is B6. So it's got vitamin C, B12, folic acid, and B6. A deficiency in any of these vitamins, as well as iron, is known to result in anemia. So people that are chronically fatigued, shortness of breath, get irregular shaped blood cells that can't carry oxygen properly, or impaired hemoglobin synthesis, which is the constituent in those blood cells that carries the oxygen. Okay? So that's a great iron supplement. So instead of taking, going out and buying just iron supplements or ferrous sulfate or whatever, or B complexes, you get it all in one supplement there. Okay. Last couple slides here. So I always recommend that anybody across the board, you start with a multivitamin, right? So instead of taking a whole bunch, the last thing I would want is for somebody to go out and buy 20 different supplements. Okay? I always say food is first. Address the nutrition first. Make sure you've got a good physical activity routine, and then supplement afterwards. But I always recommend that with good nutrition, you take a multivitamin supplement, because it's impossible to get all of the vitamins that you need with your nutrition. You could eat fantastic. The soil gets depleted, minerals get depleted, you don't absorb everything that you eat properly. Taking an extra supplement is, multivitamin supplement, a high potency multivitamin supplement is really, really important, okay? So it's been shown that the Journal of the American College of Nutrition, multivitamins decrease overall mortality and lower the risk of cardiovascular disease and cancer. Simple stuff, right? Journal of the American Medical Association supports multivitamin supplement ingestion. Multivitamins significantly reduce the incidence of cancer in men, okay? Right from JAMA. And they ensure that all the nutrients are covered. You're topping everything up. Okay? I always say, if your urine's not golden yellow, you're not taking enough vitamin supplements. It's really important. Okay? So we don't carry a lot of supplements downstairs, and I always caution people. You can go out to Walmart, or you can go to the grocery store, and you can get a very inexpensive vitamin supplement. Right? You can get a multivitamin for $6 or $8 off the shelf. But be careful, because some of those inexpensive supplements are made with a lot of fillers, or they're made with very low quantities of each of the vitamins in them, right? Each of the vitamins. So it might just be the at, or maybe even below the recommended daily allowance that Health Canada suggests. And in most cases, you want to be taking at least that recommended daily allowance or more than that. Okay? Like for instance, vitamin D. 400 IUs is recommended. Most people should be taking 1,000 to 2,000. Okay, so be careful with the cheap ones, because basically you get what you pay for. So getting a high potency multivitamin is very important. Its absorbability will be much greater. Okay, so in other words, you can take a cheap multivitamin, it's made with so many fillers, you ingest it and it just stays in your gut. It doesn't get absorbed into the bloodstream and it comes out the other end a few days later, right? So you're absorbing very minimal of it. So that's why a high potency, good quality multivitamin is really worthwhile. So we only carry one multivitamin downstairs, and that's this one. We're really excited about this. This is a Whole Earth and Sea. It's made by Natural Factors, and it's a really worthwhile multivitamin. This is the one that I take. This is the one that Kim takes. And the nice thing is the formulations are geared, typically men and women, different formulations. If you're over the age of 50, you need more of certain things. For example, B12, because your body doesn't make that intrinsic factor anymore. So it's got higher B12 in a plus 50, right? The men's multivitamin has different supplements which affect your prostate. The women's has different supplements which affect hormonal issues. Okay, so I mean, this is a no-brainer. It's a really worthwhile one. So if you're only going to take one supplement, you don't want to spend a lot of money, start with a multivitamin. That's the best way to go. Okay? Whey protein, I always recommend that, and we talk about whey protein in every single nutritional seminar. I love whey because it has so many beneficial effects. It's cholesterol lowering, lowers blood pressure, it helps bulk up the stools. It really does satisfy your appetite. It helps you eat less. If you want to lose weight, having a protein shake with whey on a daily basis, or if you wanted to get in even to plant-based protein, that's another good factor. But whey protein has a lot of beneficial effects that plant-based protein doesn't have. So I really encourage that. It's very easily digestible. It does help promote lean muscle mass growth. Okay, so it keeps the muscles. It gives energy to the muscles, right? It gives the nutrients to the muscles that they need, has anti-inflammatory properties, helps with glutathione production, and helps you lose weight. So again, if you're not doing I have a protein shake every single morning. Like that's my breakfast every morning, protein shake, and I'll add different things to it to flavor it up. Berries and flaxseed and all kinds of good healthy stuff. With the veggie greens, I always put a scoop of veggie greens in there. So definitely worthwhile if you're not doing that. So if you get up and have cereal, switch to a protein shake in the morning, you'll notice an incredible difference. Okay? We talked about kombucha earlier. We sell a lot of Kathy's kombucha downstairs. Kombucha is a fermented tea, basically. That's what it is. Keep it in the refrigerator. It's got a little bit of a fizz to it. Very healthy for it. It's got a little bit of sugar, but minimal amount of sugar in it. But it does help restore that natural gut bacteria. Okay, so that's another good healthy thing to, it's very high in antioxidants. And it does, if you've had any yeast infections, candida, it does help kill the candida off, right? So that's another good one to start having. And so what we'll do, my wife loves it. She has kombucha in the fridge all the time, and she'll typically have a little glass with every meal. When we have friends over, instead of getting out a bottle of wine, we'll get out a bottle of kombucha and have wine glasses full of kombucha. So, and the last thing is charcoal. Charcoal is nature's antidote, right, for toxins and poisons. It's often been said that if you have some sort of a gastric issue or a parasite or some sort of toxicity, especially gut toxicity, to take a teaspoon of charcoal, right? If you've been poisoned, that's the first thing they do is they give you charcoal to neutralize the poison. So we actually have charcoal toothpaste. So charcoal toothpaste does help, it does help neutralize a lot of toxins. It rids the body of toxins, so poisons, alcohol, heavy metals, medications and drugs. Treatment of insect bites and stings, charcoal is great for that. It reduces acne and helps improve skin health. If you have a lot of gas, charcoal helps eliminate gas. If you're taking a teaspoonful of charcoal, and it's a body detox agent. But the neat thing about this toothpaste is it really does whiten your teeth. It's black, black, black. So if you've never used it, it's black. You put it on your toothpaste, it is black. Like it's messy. Make sure you're over the sink. You're not wearing a white shirt because you'll get it everywhere. And your mouth will be black, black, and when you spit it out, your sink turns all black. But it really does detox it. Your mouth will feel very clean after that. So, the last thing I always recommend. So the whole idea is, and I said this earlier, as chiropractors, our whole goal is making sure your posture and your nervous system are A1. So for those of you who are not getting your spine adjusted, get your spine adjusted, because you can't, it doesn't matter what you do nutritionally or exercise-wise, if your spine is misaligned, you could be potentially damaging or causing problems. There's no way your brain can communicate properly with your gut or your immune system or your body if your spine's not working properly. So get your subluxations checked, get an x-ray and make sure you're getting those addressed on a regular basis. I get my spine adjusted at least once a week, as have my kids since they were born. I tell everybody that, that ever since they were born, at least weekly they've been adjusted, and none of my kids has ever had an antibiotic medication in their lifetime. No prescription drugs ever. My oldest guy's 23 years old, never had a prescription in his life. So, and I know there's a huge relationship there.